Like, share and subscribe the channel for more video regarding pharmacology.
Emesis vomiting is a physiologic response to the presence of irritating and potentially harmful substances in the gut or in the bloodstream. Vomiting is initiated by a nucleus of cells located in the medulla of the brain. That is called as vomiting or emesis center. The vomiting center coordinates a complex series of events. Include reverse peristalsis, gastric contractions, contractions of the diaphragm, and relaxation of the esophageal sphincter. The vomiting center has receptors for Nurokinin 1 NK1, Cannabinoids CB-1, serotonin 5-HT3, Dopamine D2, muscarinic M1, and histamine H1 receptors. The vomiting center can be activated by afferent fibers arising from the gastrointestinal tract, chemoreceptor trigger zone CTZ, cerebral cortex, or vestibular apparatus. The CTZ or chemoreceptor trigger zone is located at the end of fourth ventricle. CTZ have receptor of serotonin 5-HT3, dopamine D2, muscarinic M1 receptors. It lies outside of blood-brain barrier and stimulate vomiting center in response to blood-borne substances including cytotoxic cancer chemotherapy drugs. The excessive vestibular stimulation in motion sickness activates the vomiting center via cholinergic and histaminergic nerve fibers that projected through vestibulocerebellar region of cerebellum. The irritation of gastric mucosa by chemotherapeutic agents, endogenous toxin and poison leads to secretion of 5-HT which activate 5-HT3 receptor, and this stimuli travel from the gastrointestinal tract via the nucleus tractus solitarius (NTS) to stimulate vomiting center in the medulla. Emesis by psychological stimuli such as fear, dread, or obnoxious sights and odors is mediated in cerebral cortex. This concept is poorly understood yet. Nurokinin 1 NK1, cannabinoids CB-1 and histamine receptors could be responsible this effect. Now we will see the site of action of various antiemetic drugs. Antihistaminic. Antihistaminic antiemetic includes Cinnarizine, cyclizine and promethazine. Antihistaminic drugs blocks muscarinic M1 receptors or histamine H1 receptors or both types of receptors in the vestibular tracts that project to the vomiting center and in the CTZ. Antihistaminic drug cyclizine is used in motion sickness. Cinnarizine is used in motion sickness and vestibular disorders such as Meniere's disease. Promethazine is used in severe morning sickness of pregnancy. Antimuscarinics. Antimuscarinics drug Scopolamine is used in motion sickness. It causes blocking of muscarinic M1 receptor in vestibular tracts. 5-HT3 receptors antagonist. 5-HT3 receptors antagonist includes Granisetron, ondansetron, dolasetron, troposetron and palancetron. They are particular value in preventing and treating the vomiting and nausea commonly encountered postoperatively as well as that caused by radiation therapy or administration of cytotoxic drugs such as cisplatin. They prevent emesis by competitively blocking 5-HT3 receptors located on visceral afferent nerves in the gastrointestinal tract, NTS and in the CTZ. This enables these drugs to prevent both peripheral and central stimulation of the vomiting center. Dopamine D2 receptors antagonist. Dopamine D2 receptors antagonist are further subdivided in three parts. Antipsychotic phenothiazines, such as chlorpromazine, Perphenazine, Prochlorperazine and trifluoperazine. They are effective antiemetics commonly used for treating the more severe nausea and vomiting associated with cancer, radiation therapy, cytotoxic drugs, opioids, anesthetics and other drugs. They act mainly as antagonists of the dopamine D2 receptors in the CTZ, but they also block histamine and muscarinic receptors. Unwanted effects are common and include sedation, especially chlorpromazine, hypotension and extrapyramidal symptoms including dystonias and tardive dyskinesia. Metoclopramide. Metoclopramide is also a D2 receptor antagonist. It acts centrally on the CTZ and also has a peripheral action on the gastrointestinal tract itself, increasing the motility of the esophagus, stomach and intestine. This action not only adds to the antiemetic effect, but explains its use in the treatment of gastroesophageal reflux and hepatic and biliary disorders. As metoclopramide cross blood-brain barrier, it produces a number of unwanted effects including disorders of movement, more common in children and young adults, fatigue, motor restlessness, spasmodic torticollis, involuntary twisting of the neck, and oculogeric crises, involuntary upward eye movements. It stimulates prolactin release causing galactorrhea and disorders of menstruation. Domperidone. The mechanism of action of domperidone is similar to metoclopramide, but it does not readily penetrate the blood-brain barrier, and is consequently less prone to producing central side effects. It often used to treat vomiting due to cytotoxic therapy as well as gastrointestinal symptoms. Nurokinin 1 receptors antagonist. Nurokinin 1 receptors antagonist. Aprepitant blocks neurokinin 1, NK1 receptors, and it is used with other antiemetic for preventing acute delayed nausea and vomiting induced by highly emetogenic anti-cancer drugs such as cisplatin. Other antiemetic drugs includes the synthetic cannabinol nabilone, which has been found to decrease vomiting caused by agents that stimulate the CTZ, and is sometimes effective where other drugs have failed. Unwanted effects are common, especially drowsiness, dizziness and dry mouth. High-dose glucocorticoids, particularly dexamethasone, can also control emesis, especially when this is caused by cytotoxic drugs. The mechanism of action is not clear. Dexamethasone can be used alone but is frequently deployed in combination with a phenothiazine, ondansetron or aprepitant.
Like, share and subscribe the channel for more video regarding pharmacology.